Hi everyone, I'm sharing this video with you just to let you know about the usage of Vest Immobiliser. Just a brief background, I had met with an accident, a car accident, and for that I had an injury in my cervical spine. My C2, the most important of the cervical spine, got very badly affected. It dislocated and it has a fracture. So I was immediately admitted to the hospital, and the doctor had advised me that since there is no compression in the nerve, so there should be an external device attached for me, which I have to adjust with this for a little longer period, maybe 3 to 4 months. So accordingly, I was implanted with this HMI, Vest Immobiliser, at the hospital. So this requires for a full cure to be adjusted with you or to be owned by you for a longer period, 3 to 4 months. So it's not easy. You have to maintain it. There are certain guidelines. You have to make it part and parcel of your daily life. It's not easy, but it's possible. Usually people get, seeing the look and feel, people get very scary, and there is a feeling, oh my God, how I'm going to bear it, how I'm going to, be with this for 3 to 4 months, how I'm going to lead my daily life. But listen from me that I have been wearing this for last 3.5 months. It's difficult but manageable. So I'll just go one by one. What is the Vest? Just a brief one. So it's a neck immobilizer which actually straightens the upper portion of the cervical spine so that there is no deformity and the fracture gets completely healed over a period of time. So the entire frame which you can see on the head, there are 4 pins which are attached to the skull, and this entire frame made of carbon fiber. Along with it is fixed with a vest. If you can see here, this is a vest which is there on the torso, attached to the torso, fixed there in your body. And the border of this vest is there made of the sheepskin. So it's very important, since it is there part and parcel of your body for 3 or 4 months. It's very important to take adequate care of it. Though I know that doctor would advise, so more so, it is important to kind of follow that meticulously. So the pin site requires a real care, at least twice a day. It requires with either with a kind of any clean spirit, or any, even it is possible to do with water. There you have to clean it on the side of the entire side pins. It has to be cleaned thoroughly. No other kind of soap or any liquid need to be used. Simple water also will do, and with help of like a bud, you can do that. So that has to be followed meticulously. The whole idea, there should not be any dirt which can lead to rash or allergy in the skin or infection in the skin, which one has to be aware of. So one is the pin site care, cleaning it twice a day. The other is that there might be kind of a irritation on the pin site because it is pressing there. So there is a particular kind of a finger movement, a massage you can say, which need to be done alongside the pin sites. That is also twice a day. That will give you a relief. Even if you feel that this is holding you too much and there is irritation there on the pin site, so the moment you do like this, for 10 times on all 4 sides of the pin sites, you will get a relief. So that is the other important part, need to be mindful. The third point is maintaining the vest in a very cleanly way, because it is there attached in your body on top of a normal t-shirt, and that you are wearing for 3 to 4 months. So of course on a daily basis it has to be cleaned with a very wipe out with a wet cloth, but there should not be very careful about so that there is no water seepage inside. So the most important or careful one has to be while taking the cleaning the during the bath. So bath is possible, it's like a sponge bath or a full cleaning is possible, but except this portion of the body, this you can't do because this is fixed. So you have to wrap it, either you can wrap it with a towel or you can wear the shirt from the top and then fold it, and then you can clean the rest part of the body. That has to be cleaned regularly because skin maintenance with cleanliness is important. Otherwise, if the dirt is accumulated, that will lead to skin irritation or infection. But at the same time, one has to be careful so that inside the vest water doesn't go. It has to be always a wet dry cloth kind of a thing. So cloth should be wet, but it should be completely soaked. Then it has to be put inside the in the border, so that to the extent possible, so that the skin is cleanly maintained. And people get kind of the very much perturbed about what will happen to the hair, because this also had happened with me. I was very worried. So shampooing is possible, but definitely it is recommended to take very much kind of a precaution, and of course in a interval. It's not that daily you do this. Shampooing is possible, maybe you can do that once in a week or once in 2 weeks. And for that, first the lower portion of the body from the neck has to be completely wrapped with either kind of any plastic sheet kind of a material or polythene sheet, which will help not to avoid the water seepage inside. And then a towel, the big towel can be folded and be tucked around the neck. So then it is the entire lower portion gets well protected. And what you have to do is you have to put a big bucket on an elevated small stool, and you have to sit on a chair, and doctor will tell you you cannot bend from, of course the neck is immobilized, but you are allowed to bend from the waist. So what you can do is, sitting in a particular height, you can bend from the waist like this, and then from the top the shampoo can be applied, and it has to be rinsed thoroughly. You have to be very careful so that water is not going inside. So that is the care of the hair one has to maintain, because without shampooing for 4 months it's not possible, but the technique has to be thoroughly adopted. Now at the time of taking food, it's very important to be cautious. It's always recommended that you put a small towel or a scarf over here while taking food, and it's recommended that put the plates or in the elevated table, or on the table itself. If you are having on the dining table, put something little elevated. You can use like this. You can use like what we see there in the hospitals for the patients being used. At home while you are there, you can think of arranging this. This will be helpful so that this can be adjusted, and you don't have to bend much. It is to be at this height so that you can take the food. But since you cannot totally look at the bottom, so the entire plate from the food you will not be able to see. So that's the reason you should always be careful to put a scarf or a small towel over here, so that your waist is maintained clean and it doesn't get soiled with the drop of the foods. This is very important. And the other aspect, one very important aspect, is that this has to be, this is there. You can see that there are screws, and there are, kind of nuts kind of a thing are there. So these has to be these pins have to be regularly tightened. For that, this is possible to do at home. Anyone in the family can help you out. Doctor will first show you that how to do that. So one has to put it here, and then press it and move it on the clockwise movement, so that these get tightened. Because the most important thing, this keeps your neck entirely immobilized. So it has to be, that's the whole purpose. So if it is loosened, that will not be helpful. So similarly, the pins are there. If you can see, these two can be from both the sides. It has to be placed and it has to be tightened. It's not required to be done daily. It once in a week normally is possible, but definitely that depends on whether this is really got whether there is a little bit of looseness is there. If you feel that, then even twice a week is also recommended, but once a week of course need to be done. That is there, and this in this entire frame, there is a velcro also which is there tied in the vest. So since it is holding up to the vest is fixed from this frame which is made of carbon fiber. That helps out because it is little light. Normal metallics are very heavy to bear out, so if the frames are made of carbon fiber, if you can see here, this is little light and eases the entire process and helps you out. The weight is less, and then it is fixed, as I said. So here also it is tightened towards this vest up to this. So there also you have to be careful so that the velcros and the belt here is not becoming very loose. If it is there, you have to tighten that as well. So that maintenance of this, in the proper position, you have to be very careful that way. The other important part, which people ask me that whenever I make that, oh my God, what is this and how do you sleep? And so I say that yes, that is possible. Initially you might feel it alarming, so I will show you how I sleep, or what is the method you should follow. So while sleeping, it's difficult, especially at the initial period, entirely difficult to lie down on the bed. Entirely lying down actually pains because there is frame in the back side, as you can see, and so that's why it is difficult. But it is comfortable that if you do like this, like in a kind of a sofa, where you can see here, I'm just stretching my leg here, and it's almost like a recline. I'm just reclining on the back because it can be little bit of slanting position here. So it's almost like a recliner, so that you can put your leg in this, but on the upper side up to this you can put it, right? But for that, just to make it comfortable and to ensure that you have adequate sleep, so on the back side, this kind of a pillow you can put here, inside the frame which is there in the back. I'll just show you how it's being done. So there is a frame, so that the gap between your neck and the frame, it should not be in a hanging position, so that gap is mitigated and you feel comfortable absolutely with this kind of a pillow. So once this is fixed, that's the first one. Then what you can do is, just to make it more comfortable, on the back you can put a big pillow, right? Yeah, so you can see this. Yeah, so you can see this. Yeah, so this is a big pillow which on the back side of the sofa, on the rest side, you are just putting it so that you feel additionally comfortable, because the entire night your back is going to be rested on this pillow. So its recommendation is soft and big one pillow, you put it here. So then the back side is sorted with these two pillows. One is this, as I told you, and one is this, so that you feel absolutely comfortable and entirely rest your back on this. But on the sides also you have to feel comfortable. So for that, as per your convenience, you can give as many number of pillows. There's a bit of more pillows need to be used, so you can put different size of pillows over here. I used to have this kind of pillows, or a big pillow like that, or a cushion, pillow or cushion, anything you can use as per convenience, like that, so that your hands are not in a hanging position. You also feel comfortable, and you can put like this. So this is the entire posture. You can feel very comfortable, and believe me, I have been sleeping for last 3.5 months like this, and not much of difficulty you will have if you manage this way, because that's one important thing comes in people's mind. So my advice to all who have been maybe that due to the situation, advised by doctor to use this HMI, Vest Immobiliser. My advice would be that, as an user for last 3.5 months, close to 4 months, that don't get frightened. It is, yeah, it's difficult, but it's manageable. And take it from me that it actually helps. The advantage is that you don't have to go for an invasive surgery. From outside this implant and immobilizer, your fracture will get healed, and this whatever adjustment you do this way, ultimately you will get good result, because my scan for latest scan report actually indicated that there is very good sign of the union of the the fracture in the situ, in the particular place, and there is very positive sign of union, and it is getting strengthened. So my advice, friends, we all know that situ fracture is quite common, maybe due to fall or due to accident, but if this is possible, that doctor recommends you this, don't get frightened, adjust your life to this, and please be recovered, right? Thank you.